Ladies and gentlemen, welcome back to the Health and Wellness Spot, and I am Dr. Lewis. Now today I want to explain to you what First Pass Metabolism means. Now it's also called First Pass Effect or pre-systemic metabolism. Now when you hear metabolism, it's either you're breaking something down or you're building smaller things to make a big thing. However, in this case, breakdown will basically mean metabolism will basically mean the breakdown. So we are breaking down a larger molecule to form smaller molecules. Now, first pass metabolism basically means when you take a drug, you are intending to treat a headache, that drug goes into the stomach, then it's supplied, absorbed, and then goes into the liver. Then it's broken down again to give you either active components or inactive components. So once it is broken down in the liver, some of this drug is excreted. There's a percentage that goes out through urine and through the biliary system, which is basically feces. Okay. So now, basically, by definition, first pass metabolism is just the phenomenon that a drug is broken down, and this leads to reduction in the concentration or the amount of drug that goes into the systemic circulation. So here we have a diagrammatic representation from the mouth all the way to the systemic circulation, which is basically the heart and all the other parts of the body. Okay, so now when you take a drug, so let's assume that this is a capsule, an amoxicillin capsule. So you've taken a drug, or let's assume that this aspirin, so this is 300 milligrams of aspirin. So when you take 300 milligrams of aspirin, you take it through the mouth. Now remember, there are several routes of drug administration. Okay, one of this route, and the oldest route, is basically the oral route, the one that goes through the mouth. And that is the reason why we are discussing first pass metabolism, because other routes, like let's say sublingual, the one that you put a drug under the tongue, then we have the intravenous, the one that goes through the vein, the intraarterial, the one that goes through the joints, intraarticular, okay, intramuscular, the one that is injected into the muscle or the gluteus, okay, and all this, the subcutaneous, like for the depot injection in women, you use the subcutaneous or intra subcutaneous. So these are all means, even the nasal, the inhalation, all these are routes or channels through which drug gets into the body. Now, all other routes like the sublingual, the intravenous, they do not experience first pass metabolism, because for first pass metabolism, the drug has to go through the liver. So anything that you take through the mouth has to go through the liver to be detoxified, to be metabolized, so that you get the active compounds or inactive compounds. So the active compounds goes to be used, the inactive compounds gets out to be excreted. Okay, so that's why we're talking about first pass. So this is basically for oral or orally administered drugs. Now, if you take a tablet of aspirin, 300 milligrams, when it goes into your stomach, what happens is in the stomach it can be dissolved. So because here we have the acid, so you can dissolve this drug into that stomach juices and stomach fluids. Then this makes it easy to absorb. It makes the tablet disintegrates to release the active drug. Okay. Also, some of the drugs do not release any active ingredient in the stomach until it goes into the liver. Okay. So we will hold that thought, because we will talk about that later on in the video. So now that drug comes into the stomach, gets dissolved or dissolute, there is dissolution, then goes into the small intestine, so it can be absorbed through the stomach, and this is the hepatic portal vein, or it goes into the lumen, into the small intestine, where we have a network of capillaries that take this drug for absorption and goes into the hepatic portal vein and straight into the liver, then leaves to the heart and systemic circulation. Some of this drug, the liver breaks it out, and there's a percentage that goes out after it has been metabolized through biliary excretion. This is basically meaning through feces, and also sometimes through urine. So that's where the drug is being excreted. So when you take this drug, not all of this drug will go straight into the systemic circulation for a reason. Reason number one, we have these stomach juices here, or the HCl, that can interfere with the amount of the drug that is coming in. So you can break down that drug through this hydrochloric acid in the stomach. Number two, when we come down into the duodenum, we have the pancreas here. So pancreatic juices have enzymes that can break down your drug. So all the way it's being reduced, the amount of the drug is being reduced. Then we come to the small intestine. The small intestine wall has enzymes that break down that drug. And then by the time it's being absorbed into the hepatic portal vein to be sent to the liver, it has already reduced in this amount. Then the liver now breaks down a huge amount of this drug to give you active metabolites to help you heal, or to help to attach to the receptors and give you, elicit that reaction. Or the liver just makes it inactive and then gets it out through urine and feces. So once it has been broken down, the fraction of the drug that comes from the liver into the systemic circulation, that process is what we call first pass metabolism. However, that percentage of drug that gets now into the systemic circulation is what we call bioavailability. So bioavailability is basically the percentage of the drug that gets into the systemic circulation. Okay, so you'll realize for orally taken drugs, first pass metabolism will determine bioavailability. So the amount that is in the system will be determined by how much the liver will break down that drug. Okay, and that is the difference between bioavailability and first pass metabolism. So first pass metabolism is basically breaking it down, then releasing it into the systemic circulation, and the amount that gets into the systemic circulation is what we call bioavailability. So you will realize for drugs that go through the IV route, intravenous route, have 100% bioavailability. Why? Because they go straight into systemic circulation. So you inject the drug into the vein, it goes straight into bloodstream, and that the whole of that drug goes into the bloodstream, systemic circulation. So it has no first pass metabolism. It will not be broken down, and that's a high advantage if you want to achieve quick therapeutic effect for that drug. However, it can be a problem because in case of poisoning, then it's hard to reverse it, because again, it has already gone into the system. So you have to get an antidote to stop it from binding to receptors, and that might be fatal before you reverse your problems. Or just think about it, you've injected the wrong drug into this patient. That means you will have a hard time getting to reverse this drug because you had not prepared any antidote to help you recover from effects of the drug that you just injected the patient. So you'll have a hard time trying to reverse these effects. So drugs that go through IV, all of the drug goes into the systemic circulation, and that is what we call 100% bioavailability. So it is always available there in the systemic circulation. So that is it. So now there are factors that affect the drug absorption. So once you dissolve this drug, then it goes into absorption through the gut lumen, into the capillary, into the portal system, and into the liver. What are the factors that hinder absorption or affect absorption of this drug from the stomach or from the gut lumen? Now, number one is motility. For instance, let's assume that this person is having diarrhea. So that means the stomach is contracting, the small intestines are contracting, and peristaltic movements are quick and fast to just excrete or evacuate the bowel. So if you take a drug when you're diarrheaing, then that means this drug will get out quickly before it gets absorbed. So a very small percentage of this drug will be absorbed. Number two, in case you have like constipation, meaning there is delayed excretion or evacuation of the bowel, that again says you will absorb more of the drug. So at some point that will look like constipation is of added advantage, because you want to achieve a certain amount of the drug in the system so that you heal or you start fighting that infection. But constipation is quite annoying, so you cannot take that as a good effect. Okay, and then blood flow towards the gut. Remember, the stomach and the intestines have high amount of blood vessels, the capillary networks, so that blood flows into the lumen, and then food and nutrients are absorbed, and even those drugs are absorbed quicker, and then the blood takes it to the liver. So if there is high blood flow towards the lumen, then that means that drug, a high amount of it will be absorbed. Now, how do we achieve high amount of blood flowing into the lumen and the stomach? By eating food. So if you take drugs with food, then that means there will be a lot of blood flow towards the stomach and towards the intestines, so that this food is absorbed after digestion. And therefore, if you take a drug with food, that means its chances of being absorbed and its bioavailability might be high. Okay? Even though it has first pass metabolism. However, there are drugs that have a higher ability to be first pass metabolized, and that is what we call heavy first pass metabolism. So if a drug has heavy first pass metabolism, then that means even if it is absorbed, the liver will clear it all. Examples of these drugs are basically some of the drugs that we use might experience a lot of first pass metabolism, and therefore they will not be available into the system. Example is GTN. Now GTN is basically glyceride trinitrate. So this is a drug that is used to treat heart conditions like angina. When you start having those heart attacks, then GTN is a very good drug for you. But this drug has extensive first pass metabolism in the liver. That means 90% of this drug will get out of the liver when it's excreted. So you will get a very small percentage into your system, and that will not elicit any effect. So you'll end up dying of that heart attack. So that's the reason why GTN is basically these are nitrates. That is the reason why it is given sublingually. So you put it below the tongue, because there it will be absorbed faster, and it will avoid, or it will bypass the liver. Therefore, it will go straight into the system. Effect is faster, and then you will recover from your cardiac arrest or heart attack and angina. Okay, so GTN is one of the drugs that is extensively metabolized. Now, another drug is heparin. Now, heparin is a drug that is used as an anticoagulant. Basically, what it does is it thins blood. Okay, so it will help people who have cardiac conditions, heart conditions. Now, the reason why it is not taken orally is because heparin is a large molecule, and therefore absorption of this drug is a problem. So it will get out through feces. Immediately, you take it through the mouth, it cannot be absorbed, it gets out through the feces, and that's a waste of time. And therefore, these people will have a problem, and that's why we can substitute this using warfarin. However, warfarin is another drug that interacts with almost every drug. So it gets into the liver, interacts with almost every drug, and it's a very dangerous drug. So heparin is a safer one, more than warfarin. However, you cannot take heparin orally because it is not absorbed. It gets out through the feces, and therefore heparin is given as an injection. Okay, that's why it's given as an injection. Now, another drug is basically insulin, the one that we all know. So insulin is a drug that is used as an anti-diabetic or a hypoglycemic agent. So it lowers blood sugar levels. Now, the problem with insulin is a protein. Remember, it's produced naturally in our bodies, an endogenous protein. And therefore, if you take it orally, when it comes into the stomach, gets the gastric juices, or heads into the small intestines, in the duodenum, it encounters, being a protein, it encounters the pancreatic juices, which are high in proteases. So they'll break it down. Once they break it down, then you cannot absorb insulin. It will just go out. Okay, it will be broken down as a protein, and therefore its therapeutic effect will not be felt. So insulin, GTN, and heparin are drugs that are totally involved in this system, and I already explained how the effects happens when you take them orally. So that is about the drugs. Now so we've already said on the stomach, the motility, we've said about the constipation and diarrhea, we've talked about gut blood flow. We'll now talk about food again. If you take it with food, you increase blood flow towards the stomach and the gut, and therefore absorption of that drug will be high. Then the last one has to be other drugs. So for instance, if you take a drug with other drugs, like let's say in antacids. So let's say you have a drug that is absorbed in acidic pH, a drug like aspirin, acetyl salicylic acid. It is supposed to be absorbed because it's an acidic drug, then it's supposed to be absorbed in an acidic environment. And therefore, this drug is absorbed in the stomach. Okay? So now you take this aspirin with an antacid, let's say magnesium hydroxide or trisilicate. So magnesium trisilicate comes and neutralizes the stomach acid, and therefore aspirin will not be absorbed. So other drugs hinder the absorption of others, and therefore you cannot take an antacid with acidic drugs like aspirin because they will not be absorbed. And if you know, aspirin affects your stomach environment, so it causes ulceration or gastritis. So that might be a very profound effect. You will see that side effect being magnified. Okay, then other foods again. So you see, you take a drug with food, then there's a problem because of food and drug interactions. So this is an example of drug and drug interactions. There's also food and drug interactions, which means you're taking a drug with food. What is the interaction with this food? Like if you take aspirin on an empty stomach, you'll have a problem because it will expose you to gastritis. But if you take it with food, that's the reason I told you take it with food. When you take it with food, the effects are lowered. Now, if you take a drug like doxycycline, most of you know that tetracyclines are not supposed to be taken with milk. What is the reason behind taking tetracycline, not taking tetracycline with milk or doxycycline with milk? It's because when milk comes into the stomach and interacts with doxycycline, it forms chelates. Chelates are basically unabsorbable compounds or complexes. So these complexes are not absorbed, and therefore you will keep on suffering from that brucellosis. You will keep on suffering from that cholera. So you're taking doxycycline to help you treat cholera or brucellosis, but you took it with milk, and then milk made insoluble complexes with this drug, and therefore that drug was not absorbed, and therefore you did not get the effects of this drug in the system. Therefore, you'll keep on suffering. So you should not take some of these drugs with different food. So the clinicians will tell you, and the pharmacist will tell you that this drug you should not take it with alcohol, like metronidazole. This drug you should not take it with milk. So take cautions when you're told that, because you'll be affecting the amount of drug that will go into systemic circulation. And remember, we want the amount that is going into systemic circulation to be higher so that we achieve a certain therapeutic effect on the bacteria or on even the condition that you're suffering from. So we need it in higher amounts in the system so that we clear the condition that you're suffering from. Now, you've taken a drug, you've absorbed it, it's broken down into the liver, goes out through the biliary system, which is the feces, or goes out through urine. Now, the remaining amount, the small amount, goes into circulation, systemic circulation through the hepatic artery. So once it goes into the heart, it's pumped out into the system, interacts with different receptors, and then starts eliciting a therapeutic effect. Now, if this amount in the system is lower, we will suffer two consequences. Now, consequence number one will be subtherapeutic dose, which basically means a lower amount of this drug in the system. Now, that is also called an underdose. Now, if you have lower therapeutic, you have subtherapeutic less, which is sub means less. So subtherapeutic dose in the system, that means you will not kill the bacteria, or the condition that you're suffering from will not disappear because you have a lower dose of the drug in the system. And we want a higher dose, or a therapeutic dose. So we don't want a sub-therapeutic dose. We don't also want an over-therapeutic dose, because that will be exposing you to more side effects of the drug. So we want a therapeutic dose. So if you have a higher metabolic rate or first pass metabolism, the drug goes into the system is lower. And once it's lower, then you will suffer subtherapeutic dose, which means it will not elicit the effect that you want. Number two, you will have drug resistance. Now, imagine if in your system or in your bloodstream, you have a certain number or population of bacteria. Now, these bacteria require like 70% of the drug for you to clear them. So if they require 70% of the drug for you to clear them, and yet you've broken this drug to a higher extent in the liver, and therefore maybe 30% of the drug, which is an antibiotic, is going into the system. Now, this 30% is a subtherapeutic dose. 70% is the therapeutic dose. So if you have 30% of the drug in the system, that means this bacteria will sense, because this will kill a certain amount of bacteria. However, the remaining bacteria will sense there's a problem. So what they do, they start mutation. Once they mutate, then you will have a problem, because once they give new offsprings that are resistant to this drug, that is what we call therapeutic drug resistance. So this means even if you keep on using that drug, it will not kill any bacteria. They will keep multiplying and they'll keep killing your system. Therefore, it is very necessary for you to know how much of the drug you should give and how much of the drug is broken down in the liver, so that you know how much of that drug will get into the system. And therefore, does it reach the therapeutic dose, or will it be subtherapeutic? Okay. Now, this is for the pharmacists. So let's say you have taken like aspirin 300 milligrams orally. So this is what you've swallowed through the mouth. Now, this 300 milligrams is not the same amount that will get into the systemic circulation, because of the processes that happen from the mouth all the way to the liver. Okay. So if you've taken 300 milligrams of the drug, and then you're told that this drug is 70% absorbed. So 70% goes into absorption. So you'll absorb 70% of this drug through the stomach and through the gut. So this is 70%. So how much of the drug have you absorbed? So it will basically be 70% of 300, which will be 300 milligrams times 70 over 100. Now this will give you the amount of the drug, which is basically 210 milligrams. So you took 300 milligrams of a drug, but you absorb 210 milligrams of this drug. So in your system, towards the liver, you have 210 milligrams of this drug. Now, the hepatic circulation, or the hepatic system, breaks down this drug. 60% of this drug is broken down in the liver. So what you're getting is 40% going into the systemic circulation. Now, that means if 60% is broken down and excreted, how much of the drug are we left with? So we have 210 that is absorbed. Then the remainder is taken out through feces. So you have absorbed 210, which is 70%. Then it goes into the liver, and the liver breaks down 60% of this again. So that will be times 60 over 100. So which gives you 126 milligrams. So now, 126 milligrams of this drug is taken out, because 60% of the drug is taken out through the hepatic system, is excreted. So broken down and excreted. So 60% goes out, which means 126 milligrams of this drug has gone out. So how much of the drug are you left with to go through the systemic circulation? So that will be basically 210 minus 126, sorry. So this will be 84 milligrams. So going into the systemic circulation, you will have 884 milligrams of the drug. Out of the 300 milligrams that you swallowed, only 84 milligrams are available for therapeutic effect. Now, assuming that the therapeutic dose of this drug, so the therapeutic dose, assuming is 168 milligrams. So that you need at least 168 milligrams in your system to clear the bacteria that are in the system. That means if you take one tablet of aspirin, which is 300 milligrams, you will be going into subtherapeutic effect. So what you need is a double of this, so that you get 2 tablets of aspirin to give you 600 milligrams. Once you get 600 milligrams, then all this doubles up, and the end result here will be 168 milligrams going into the systemic circulation, and that is enough. That is the therapeutic dose, and that is the amount that we will absorb after swallowing 600 milligrams of a drug. Now, on that note, some of you are used to separating that, let's say like the capsule, the amoxicillin capsule. You want to take it as fast as possible, or even that omeprazole tablet capsule that you normally take for your ulcer effect. So you open it up, then you swallow the powder. Now you're wasting time. You're actually getting into more effects, more side effects of this drug in your gut. That drug, if it is a capsule, it is basically designed to harbor that drug. The drug that is inside this capsule is basically to harbor that drug so that it avoids specific enzymes in the stomach or the gastric acid, which is HCl. So this capsule is there for a reason. Okay, if it was supposed to just be released in the stomach, it would have been made as a disintegrated tablet or those powders, so that you just take them directly. So it is made into a capsule so that when you take it through the mouth, it goes into the stomach. Then this gelatin gel helps it to get or to bypass the stomach acid so that it gets into the small intestine where it is supposed to be deposited. So this drug is supposed to be deposited into the small intestines, and therefore this capsule helps it to bypass this gastric acid into the small intestines where there is a basic pH. Then it's broken down. Now it is disintegrated. The capsule now separates to release the drug. Once it releases the drug, then now you can absorb the drug through the small intestine. Okay? So depending on where the drug is supposed to be absorbed, we design, or the pharmaceutical industry designs drugs to just deposit that drug in its appropriate place. So if you disintegrate this capsule already, if you open it up and then you swallow that powder, and yet the content of this powder is supposed to be absorbed in the small intestine, that means you've exposed this powder or this drug to acidic environment, then it will be broken down, or it will get a reaction, and therefore you will not get a drug that you expected to get in the small intestine to be absorbed to give you a therapeutic effect. And therefore, let those capsules remain the same way they are. Okay? That is just for people who like separating this capsule, for you to thinking that this drug, once you separate it, it is easier for you to get the therapeutic effect because you've swallowed now the powder. You're not helping the body. The body knows what to do to this drug. That's what we call the pharmacokinetics. Lastly, in the liver, we have a system of enzymes that are called CYP450. Basically, CYP means cytochrome 450. So this is an enzymatic system that helps you break down drugs, metabolize these drugs. So if a drug goes, you have absorbed it and goes into the liver, it encounters this system, and this system is just designed to help you break down drugs. So when you break down drugs, you can get active components that will help you. They'll go into the systemic circulation and go elicit a reaction. You will also get inactive components that will be excreted. So that's the role of the liver, to just detoxify drugs, to make inactive drugs active so that they can help you heal. So once the drug gets in contact with this system is a system that totally breaks down all these, metabolizes drugs. So this system can be activated by drugs, and it can also be inhibited by drugs. So there are drugs that once they get into the liver, they trigger this system to break down other drugs. Also, There are drugs that when they get into the liver, they block this system, and therefore it cannot break down drugs. So you can take two drugs, one drug called a CYP inducer, meaning this drug activates this enzyme system to break down drugs. So if you activate this system, then the other drug that you took with this one that activates that system will be broken down so fast, excreted so fast, it will be taken out of the system so fast, and therefore you will not get an effect of this other drug. Okay, so when you are told not to take two drugs consecutively, there is a reason. One reason might be a drug interaction in the stomach or a drug interaction in the liver. So drug interactions in the liver or food interaction in the liver, there are certain foods that activate or induce this system. So you eat some types of food hoping that food will help you absorb drugs. As we say, food in the stomach helps you increase blood flow towards the stomach, and therefore drugs will be absorbed faster. But once they get into the liver, you realize that food or that juice activated the CYP450 enzyme system. And once it activates this system, that system breaks down your drugs totally, and then these drugs gets excreted. Okay, or makes it soluble so that it can be excreted through urine. Then that drug will not give you any therapeutic effect. Therefore, be careful when you're taking drugs and other drugs, or when you're taking drugs and food. And this is where the issue of polypharmacy comes in. You get a prescription for basically diabetic patients, these people who have chronic conditions. You have a prescription that has more than 4 drugs. So you have a prescription that has anti-diabetic drugs, antihypertensive drugs, maybe that lipid-lowering drugs, and all other drugs, maybe the one for infections. So you have a prescription that has more than even 7 drugs. Most of you even take more than 10 drugs. So that prescription is a waste of time, because all these drugs, if you're taken orally, they will get into the liver. And in the liver, some of these drugs will activate this system, and this system will break down most of those drugs. Once it breaks them down, then you'll get into a subtherapeutic dose. Once you get into a subtherapeutic dose, that means you will not have an effect. So you will not recover from any condition. Again, some of these drugs will block this enzyme system. And once they block this enzyme system, that means most of the drugs that you've taken out of this prescription will not be broken down or excreted. So most of that will go into the systemic circulation. Once it goes into the systemic circulation, and you will now get all the side effects of those drugs. Therefore, you will suffer the side effects of those drugs, and you might end up even dying because of the side effects of the drugs. Again, people who have liver problems. If you have a liver problem, we've been singing in this channel every now and then that you have to protect your liver by all means for it to defend you. Now, this is a home of breakdown of drugs. So you're taking 7 types of drugs, and you have hepatitis, or you have a fatty liver. So this liver has no ability to break down these drugs. So this system is failing already. Once this system is failing, that means you will not break down those drugs to excrete them. And that means every side effect of each individual drug will be experienced. So if you are taking drugs, maybe diabetic drug or any type of drugs, then you have to fix your liver. Once you have a fixed liver, or you have a very functional liver, then that liver will help you protect yourself by detoxifying those drugs that you're taking. So this goes to those people who have chronic conditions. Please, drugs will not help you if your diet is not fixed. Diet has to be fixed for you to fix your liver, then your liver will fix those drugs. And again, if you go to a hospital and the doctor writes more than 7 drugs, or even more than 4 drugs, a prescription is supposed to have less than 4 drugs. So if a doctor writes more than 4 drugs, then we have to start questioning these prescriptions because of drug interactions in the liver. And therefore, we need to seek other alternatives that will help these patients apart from drugs alone. Because most of medics will write prescriptions to just treat the symptoms, and we want to treat the cause. Okay? So we need to fix your diet, to fix your liver. Once you fix your liver, then you can take some of these drugs. And the number of drugs are supposed to be at the lowest, and this includes those drug combinations. Okay, if one drug is combined, we have 2, like Dosage H for hypertension. Those are 2 drugs. Being in one tablet doesn't mean it's one drug. Those are 2 drugs, and therefore, if you have like 4 drugs and each of them is combined, then those are like 8 drugs. So you need to look into it. So it's my appeal to every medical practitioner. Please take care of the liver of these patients, because even these drugs, the poisons, They are poisons. That's why they are regulated by a poisons board. And once they get into the liver and they find the liver is problematic, these drugs are even toxic to the same liver, and the liver excretes them. So if you give a lot of drugs to this patient, you're doing them injustice. So this is basically first pass metabolism.